On the phone, Dr. Jack Henningfield, Vice President, Research, Health Policy, and Abuse. Liability, I'm going to ask you to see if you can correct that before we get him on. He is also the Adjunct Department of Psychiatry and Behavioral Science at Johns Hopkins University School of Medicine. Mac Haddow, Senior Fellow of Public Policy for the American Kratom Association. And I've been told, Mac, that I could say kratom or kratom, or I could say kratom.
Any number of those is
kratom is actually something that is also used.
It is, very commonly, yes.
A little bit about you, sir.
I got involved in the public policy arena. I served as the chief of staff at Department of Health and Human Services under the Reagan administration back in the old days. I ran Orrin Hatch's campaign for the United States Senate when he first ran back in the eons ago. And so I've been engaged in public policy matters and worked extensively on the Dietary Supplement Health and Education Act that passed in 1994, which is how I arrived on the kratom issue.
Have you ever used it?
I have, yes.
And your thoughts, just on personally, is that how you came into this, or?
No. I actually, because of my experience with dietary supplements, but I have a hip problem from a foolish mistake I made riding a motorcycle as a young man, and so I suffer from pain from that, and I found it's much better than taking the non-steroidal anti-inflammatories that I was using before. So it's a terrific product.
Okay, now so we have a group on from the Medical Association, and I call it fur and agains in typical Southern language. But you guys are certainly for this, and in the limited time we have, and I think we've got him back, Dr. Jack Henningfield. Dr. Henningfield, can you hear me now?
Yes, I can. How are you doing this morning?
Very good, and a good line, and we thank you. So first of all, some of the things that are being said about this as far as its addictive nature. Let's handle that first. And first of all, Dr. Henningfield, go ahead, sir.
Sure. Like a lot of things, it's not an all-or-nothing black and white issue. It's more, I think, with respect to addictiveness, it's closer to caffeine than it is to hard drugs that we think about as being highly addictive. And we know that from a number of surveys done in the United States and in Southeast Asia, where it literally grows on trees.
And I think that the National Institute on Drug Abuse answered this question fairly conclusively. They commissioned 2 animal studies that were done independently and concurrently to test the addiction liability, which is a critical factor in scheduling or banning decisions. And the conclusions of both of those independent reports was there's no significant addiction liability. And they found, interestingly, which validates what we're hearing anecdotally, that the test animals developed a reduction in the cravings for the morphine, which was the reference drug in those studies. It is not dangerously addictive, and the NIDE has now embarked on about 15 million studies.
You do hear people who are addictive, and they say they're addicted to that. Is it a situation where they are addicted to maybe something that has been contaminated with the kratom product, or is it some people just have the propensity to be addicted to it?
Both. I think that the adulterated products represent a serious problem. We've got to clean that up. The American Kratom Association strongly supports regulation to eliminate that problem, or at least reduce it significantly. We can't eliminate every bad actor in the system. I think that there is a brain mapping that goes on when you get into opioid addiction that changes your behavior patterns, and I think it's very possible to get addicted to anything that you overuse because of that issue.
Are most of the products on the market today, Dr. Jack, do they label that as a warning on the program, on the packages that are sold now as far as marketing?
Well, the labeling is frankly all over the place, and that's why we need regulation to make sure that products are labeled accurately, that they don't make claims that are not true, and to make sure it's pure. The biggest problem with kratom is not the natural kratom plant. It's products that are marketed by bad actors and not up to the standards of what people expect when they buy food products. Nature got it right. Nature got the levels of the alkaloids in kratom at a level that a lot of people find helpful and has relatively low risk.
Some in the medical field said kratom, once you ingest this, attaches to the opioid receptors in the midbrain, resulting in the release of dopamine. And this makes it addictive, right or wrong?
Wrong. Kratom is almost universally used orally, either swallowed or made into tea-like beverages. A lot of people use it as a morning pick-me-up.
Mm-hmm.
And as Mac Haddow mentioned, the animal testing shows that its abuse-related profile is very mild compared to opioids, and its safety profile is very favorable. For every death that has been reported as associated with kratom, there is more than 1,000 opioid overdose deaths. And that doesn't mean kratom's absolutely safe. It means that the risk potential is far preferable to opioids, which it often replaces.
All right, let me ask Mac, who's going to do this? Is the Food and Drug Administration going to do this? Who's going to provide the consumers in the state of Mississippi with a pure product that we can be assured that it is pure?
There's only one way to do it. The Food and Drug Administration refuses to actually regulate it the way that they should, and so we're asking the states to step in. 4 states have already passed the bill. 21 states currently are evaluating the bill. Mississippi had a ban. Yesterday, the Senate Drug Policy Committee made an important first step. They replaced unanimously the proposed ban with the Kratom Consumer Protection Act, which will enact real reforms and protect consumers. We're strongly in favor of that. Let's get rid of the bad actors.
And that starts what? Is it July 1st?
Well, it is. It's got some more work to do through the legislature. This is just one committee.
If it passes.
Right. If it passes, it would start in July. It's an important step that we're finding in the 4 states that passed it. It has changed the marketplace dramatically because consumers are now safe. They can go to a store and they can buy a safe Kratom product.
Do they sell these in convenience stores in those states?
Yes.
And we know it's a pure form there.
Yes, because it's against the law. Now, if they're caught in selling an adulterated product, then they suffer the penalty for it. But rather than criminalize the people that use Kratom, which bans do, let's go after the bad actors in the system.
Dr. Jack, this can be smoked also, can it not?
It is very rarely smoked. It turns out that, it's like caffeine, where you could inject caffeine, you could smoke it, but the vast majority of people prefer to take it as a beverage or consume it. And the same is true with kratom in the United States and globally, and that contributes to the safety profile. You can get yourself alert in the morning with cocaine or amphetamine, but most people prefer caffeine, and it's a safer substance to do the same thing. Same thing with relieving pain. You can relieve pain with opioids, or a lot of people get some pain relief with kratom.
I got to ask you this,
much
though.
Preferable.
And we'll do this when we come back. We got a break here, hard break. But I want to ask you this when we come back: if somebody is subjected to too much caffeine, they probably don't know, or maybe they do know they have a heart situation. They have a couple of Red Bulls and they digest a couple of these. There are no warning things on the label as we have it now. Are those warning labels in the states that you're talking about? As far as any health warnings?
Well, there are some health warnings that are required, both in terms of minors using them, pregnant women. We support those entirely, yes.
Well, all right, back to our conversation here with Dr. Jack Henningfield and also Mac Kratom. Mac is the Senior Fellow for Public Policy for the American Kratom Association, and Dr. Henningfield is Vice President, Research, Health Policy, Abuse, Liability at Pinney or Pinney. I think it's Pinney Associates. I'm not sure, but he'll correct me if I'm wrong. Bethesda, Maryland. Professor, Adjunct, Department of Psychiatry and Behavioral Science at Johns Hopkins University School of Medicine. And that requires him to have kratom for his back because the calling card is so heavy that he may have back pains. But all right, let me ask you this, because is or is not kratom an opioid?
Kratom is not an opioid. If it was an opioid, either by chemistry or by nature, it would automatically be regulated as an opioid. That's the law in the United States and globally. It is a substance that has some effects like caffeine, and it also does have some opioid effects. But the big difference between kratom and conventional opioids is that it does not have the powerful biological rewarding and euphoriant effects of opioids, and it does not have the powerful respiratory depressant effects of conventional opioids that kill people.
How do we know that we're getting a pure product? And again, what is a pure product? Because there's got to be some, just like medical marijuana or marijuana itself, marijuana has different grades and different strengths. How do we know, Mac, that you're getting what you're getting?
Well, Jack...
Well, that is exactly why we need regulation, because my opinion is that most marketers are marketing on the basis of quality of product and price and other factors. But there are some bad actors out there. And I think our whole system with regulating foods and dietary substances and natural products, whether it's coffee or whatever, is make sure people get what they're paying for, that it's clean, hygienic, and it's labeled properly. And regulation can do that. Banning will not.
The CDC recently reported, and this was last year, that data gathered in an 18-month period from 27 states revealed 152 dissidents tested positive for kratom. 91 cases it was determined to be the primary cause of death in 7 patients. Well, let me finish it.
CDC concluded.
Well, that's what it says here. The CDC recently reported, and in 7 patients, only kratom was detected. 80% had a history of substance abuse. 90% were not under medical supervision for pain or addiction. Your thoughts?
Yes. What CDC said is closer to your last statement. They said that medical examiners reported 91 kratom-associated deaths, that, as you mentioned, the vast majority were known to involve other drugs. And then CDC pointed out in the 7 where they did not identify another drug, because of erratic procedures that some medical examiners use, they couldn't rule out other drugs. So CDC did not actually state that kratom caused any of those deaths or was the primary cause. Now, again, that doesn't mean that kratom has never contributed to a death, but the CDC's findings have been misrepresented in the general literature.
Do you think we have a problem because the point of marketing here, as far as the merchandise being in convenience stores, it's too easy, and the people there are not trained? It's not a drugstore. It is in a convenience store, and we have a lot of violations going on, them not checking cards or selling to minors. Mac?
I do not. I think that the form of the product is the most important thing, whether you buy it in a convenience store or in a vitamin store or in a smoke shop. It does not matter. It has to be regulated properly. And you don't clean up the problem by taking it out of a convenience store. You don't clean up the problem by saying you're not going to allow liquid tinctures. You clean up the problem by requiring that every product that is offered to a consumer is pure kratom and without the adulterants.
But it's a lot like other things. If they want to buy, you can buy this on the internet, can you not?
You can. And what we've found from consumer surveys is that what kratom consumers want is to be able to go to a local brick-and-mortar store and know that they're purchasing safe kratom. They know the internet's the Wild West.
But here's one of the things that I do not understand, because the FDA did classify kratom as an opioid February 6, 2018. Did they change it since then?
They were wrong. Commissioner Gottlieb at the time was absolutely wrong on the science.
Did he issue a correction on that?
No, he refuses to. What he claims
well, wait a minute. Now, you're telling me that they still list it as an opioid.
The good news is that we don't have to rely upon the FDA because they're wrong on the science here. What we rely on is the Drug Enforcement Administration. They have the sole authority under the Controlled Substances Act in the federal government to classify that as a scheduled substance. They found the FDA is wrong on the science. They're wrong on the death data. They're wrong on the safety data. But
aren't you asking the FDA to rule on this as to make sure it's pure?
No, we wish the FDA would regulate it as a dietary supplement. They refuse to do so. What we're asking is that we treat kratom for what it is, protect the consumers for the pure product, and do not allow adulteration. That's what we want. And we don't want states banning it because that forces people into the black market, and you will have more people who will die.
I understand
as a result of that.
I do understand that. But we have some. I do not understand it. If the FDA today, and it's on their books, saying that the FDA says, excuse me, the throat's going south, that it is kratom is an opioid, you're telling me it's not, and they're wrong.
They are.
Let me clarify this.
Okay.
What FDA is saying is that it is a substance. They don't say it is an opioid, because that would not be true. That it's a substance that, in their opinion, has sufficient opioid-like effects to be banned. So they made a formal recommendation to the DEA to put it in Schedule 1 with heroin and LSD. DEA got that notification in October 2017. I do drug scheduling. I consult on drug scheduling. I consult the American Kratom Association on the science. I know drug scheduling. And DEA has done something I've never seen happen before. They have ignored FDA's request for now 2 years and 4 months. DEA is the final arbiter, and my understanding is that DEA knows what the surveys show. A, many people are using kratom in place of opioids, and banning it would put them at risk. And B, FDA was wrong on the science.
It seems that, and I understand the opioid situation, you may be trading one harmful thing for another. I don't know. To some people, you may or may not. Can you use this, Dr. Henningfield, in a vape pen? Is this a possibility to use in vaping?
Some people have tried that, and if you go to the Internet, you will find people try every bizarre thing that you can imagine, and it's out there on the Internet. And most people do not use kratom to get high because you get high much better with other substances. And people that are trying it to get high report that that is not an effective way. And people that are using it for therapeutic reasons, to wake up in the morning to manage their pain or whatever, that have tried it, said that it didn't work any better, and they preferred using it the way the vast majority of people do, which is making a tea out of it or swallowing it in powder or capsule. And they use the capsules, by the way, because it tastes terrible.
Is, in your studies, either one of you, is it there a immunity buildup on this one where you need heavier dosages as time goes on?
Well, as Dr.
There
I'm sorry,
are some people that use heavier, and those are people primarily that are using in place of opioids or to relieve pain. And the vast majority of people find a stable level that is comfortable for them. And unlike opioids, rather than interfering with work performance and putting you to sleep, what most people find is that it helps them at work, helps them work better and more effectively. That's a big difference from opioids.
Are we to the agreement from both of you that if you use a little of it, it gives you energy? If you use a lot, it would put you to sleep or makes you more of a sedative?
It has a sedating effect, but I have listened to hundreds and hundreds of people testify at hearings across the country who say kratom has saved their lives.
Final segment on this subject coming up, and I want to give them their chance here on final thoughts. First, Mac Haddow, and Mac is the senior fellow public policy for the American Kratom Association. And Mac, when you're talking to all the legislators out there, why should we regulate this and not put it on Schedule 1?
Because to put it on Schedule 1 would create a larger health hazard problem. People would die because those that are using it effectively today, and about a third of the 15 million people in America who use kratom, use it to manage their chronic and acute pain. And for those that have found it to be an effective alternative to opioids, and look at the numbers, just with non-steroidal anti-inflammatories in the same time period, the FDA cited 44 deaths for kratom. We found 3,700 deaths from NSAIDs, and we found 480,000 overdose from opioids. Kratom, it can save lives, and people, if it works for them, let's let them do that.
Who pays you?
I'm paid by the American Kratom Association.
And how big of a business is kratom in this country?
Well, I don't represent the vendors. I've heard estimates that it's probably approaching $2 billion.
In this country?
In this country.
Is that the only place we can get it, is from Southeast Asia or in that area?
Well, Hawaii now has a fairly substantial crop growing over there. They see it as a potential economic opportunity. And so I think that the future is in some of the tropical areas in the United States.
Is it of the same variety?
Well, it's conditioned
by the way,
on soil
for people
conditions.
who don't know this is a derivative of the coffee plant?
It is. It's a tree, and it's from the coffee plant.
What does it look like? Can you give an idea? One of our American trees.
I was over in Indonesia and saw it. It's probably about 40 to 60 feet high.
Wow.
It looks just like a tree with leaves on it, and the leaves are what they pick in order to extract the kratom.
We don't extract the fruit of that, if there is a fruit that comes off of it?
It's the leaves, and
It's
the leaves
just
have
the
an
leaves
alkaloid
itself.
content that has the effects.
Do we neuter the tree to do that, or how do they get the leaves off?
Oh no, they harvest in Indonesia. They harvest about 3 times a year.
Actually, tearing the leaves off?
Yes, and then they process the leaves.
Final thoughts from Dr. Jack Henningfield. Doctor, your thoughts on this?
You bet. And in terms of kratom, where you get it, Florida is actually getting a lot of money from the National Institute on Drug Abuse to study it, but they're also looking at potentially developing it as an agricultural crop. That might take a decade or so. So in the meantime, we're reliant on Indonesia and elsewhere. But let me just get back to just finalize with a few of the things that the surveys and the science tells us. We know that most people who use kratom are not using it for pain or opioids in place of opioids, but they're using it for a variety of reasons, and they're using it because for them they prefer it to pharmaceutical products, or for them it is more effective or more tolerable or more accessible than conventional medicines. And so giving them a path to safe for regulated kratom, I think, is really important. But finally, what makes this really serious, deadly serious, is the opioid crisis. And that's racking up close to 47,000 deaths a year in the United States, about 1 every other day in Mississippi. And Mississippi's population of about nearly 3 million, we estimate, includes about 150,000 kratom users. And the surveys suggest that up to a third of those, maybe 30 to 45,000 or so, are using in place of opioids. And for them, kratom is a lifeline. And to take kratom away from them would be like taking a life preserver away from somebody that's struggling in the ocean, because it's not Coast Guard approved. Rather, what we should do is do everything possible to make sure it's clean, that it's not adulterated, that it's not mislabeled, and that people are not making false claims. Nobody should say you can't get addicted or you can't be harmed. There should be reasonable warnings like we have for just about every other product in the marketplace.
Do you use it, Dr. Jack?
No, I do not.
You don't use
one of the few things I tried, along with a number of colleagues. We did our own little experiment. We all took what we believed was a standardized dose and then measured effects, and basically we didn't feel much. About an hour later, I said, it kind of feels like maybe I had a cup of tea, because I'm a little bit more alert.
Well, some people are sensitive to some people, and I am. I'm sensitive to a lot of caffeine. I know exactly what my limits are, but it's just the body makeup. How about CBD oil? Do you use the CBD oil?
I do not. And me, like most people, my main substance is caffeine.
And a cup of coffee.
And like most people, I regulate my intake so I don't get overly anxious or nervous.
Well, look,
I get what I need.
We're almost out of time. I thank you for your input. Mac, I thank you for your input, sir.
Thanks for having us.
And I guess that bill is going to be either clear committee today or not. So we'll see what happens.